I mean, just to summarize what we know from the Adverse Childhood Experiences Study, the original study that was first published in 1998, which is also worth noting because it's taken us a long time to have this conversation in our communities, despite really, really profound findings that were published in 1998. And the bottom line is that we learned a lot about how common adversity in childhood is in terms of traumatic life experiences, and that there's a clear and strong connection to adult health outcomes. Knowing that the more adversity a child experiences, or an adult experiences in their childhood, the higher the risk for really 7 out of the 10 leading causes of death in the United States of America, which is really significant. I think other important findings in that study are things like, if you've experienced 4 or more traumatic life events before the age of 18, you are 12 times more likely to take your own life. And so these findings really drive what I often think of as the root of many of our problems that we're attempting to tackle in our communities. Things like opioid addiction, suicide, all of these types of things. Often what we find is a really clear connection and dose-response relationship to early adversity in childhood. So for me, this helps us bring the conversation to that level, and so I appreciate that this panel today is even being framed in that context, because I think it's a very, very important part of how we address student mental health in our schools.
If I can cut you up, just to ask, we were talking about this right before we started, and would you just touch on a little bit the resiliency factor of individuals as well? Because I think that is important to say that we know that we can intervene early, but it's not always the case. So.
Yeah, I think, what we know about resiliency in kids is, 60 years worth of resiliency research, and we know that the biggest predictor of resilience in kids is a supportive caregiver. And oftentimes, we look at that primary attachment figure, but also important in this conversation is the role of our teachers, our coaches, our paras that are supporting kids all day long at school. And so it's worth noting that there are many people in this room, in our community, and in our school settings for sure, that have high ACE scores. In other words, they've experienced a tremendous amount of adversity in childhood, yet are extremely resilient people. And I bet you all know some of those kids or people in your community, and I bet if you ask them what helped them get to where they are, they would often say it was someone. It's not money or cognitive ability or sheer talent, but often it's clearly connected and directly proportionate with the quality of the relationships that they're surrounded by. And so it is always important to remember that an ACE score or a high ACE score does not equate dysfunction or a pathway to really negative outcomes.